Hi, I hope everyone is having a good day today. My name is Chasey and I am an aspiring nurse. I graduate from Fortis College in October of 2021. Nursing school definitely isn't the easiest thing I've ever done, but it is an experience. I'm very eager to begin working in the hospital and see what opportunities being a nurse has to offer. Just about everyone personally knows someone who is a nurse. When I reached out to some of my nursing friends for advice, they began to talk about how important it was to take care of myself emotionally. And I just thought to myself, that should be easy. How can nursing become so mentally exhausting? After doing some research on mental health in nursing, I developed a brand new perspective on the topic. I'm going to discuss with you some strategies to take in order to improve a nurse's mental health. A nurse can aid in maintaining good mental health by implementing a routine for time management, practicing effective coping mechanisms, and using exercise to support proper physical health. I'm going to begin discussing how a nurse spends their time, as it does play an important role in their mental health. If a nurse has an inadequate amount of time to complete a task, it becomes stressful and it can just create avoidable stress all around. Over time, this stress can project as a negative effect on their mental health. A strategy nurses could practice in order to better manage their time is learning how to cluster care. Cluster care strategies are prioritizing immediate needs prior to handling other responsibilities that could just wait till the end of the shift. Megan Duffy, who is a practicing nurse and contributing editor for the American Journal of Nursing, believes tasking can be so overwhelming that you actually lose sight of the bigger picture. It is axiomatic that the more you run around from task to task, the more you actually will be let behind. You can spend time to make time by clustering. The clustering strategy assists in alleviating stress by completing tasks and creating mental space. This practice implements better time management skills that will avoid negative long-term effects on a nurse's mental health. The next thing that plays an important role in a mental health, not only being a nurse, but people in general, is emotional management. It is inevitable for a nurse to share empathy with many of their patients. They are only human after all. In worst-case scenarios, the patient is or becomes terminal. Experiencing such a traumatic event, and typically does, have an impact on the caregiver's mental health, not just the assigned nursing staff. It is crucial for a nurse to learn how to manage their emotions to avoid mental health complications at work. According to the ECPI University article, Managing Emotions as a Nurse, studies show that if there is a lack of coping strategies, the professionals may experience stress, fear, and anxiety. Ultimately, the problems may lead to mental disorders, which are associated with the burnout syndrome that nurses experience. It is essential for a nurse to practice effective coping mechanisms in order to manage their emotions. A nurse could practice healthy coping mechanisms by speaking with a therapist or counselor. A therapist or counselor could help cope with emotions, change cognitive behavior patterns, and solve issues specific to that nurse's contributing stressors. The last point, and to me the most important, is the management of physical health in a nurse. It is the most important to me because you would think that a nurse would have adequate physical health, just being always on their feet. But I was really wrong. In December of 2006, Megan Fitzpatrick posted statistics on the ProQuest database stating about 1 in 3 nurses said their physical health made it difficult and almost impossible to handle their workload in the past month. Poor physical health can be a direct reflection of someone's mental well-being. If a nurse is not supporting their physical health by getting enough sleep, maintaining proper nutrition, and exercising, it can lead to mistakes. These mistakes include patient errors such as inadequate administration of a medication or improper treatment for wounds. These potential errors can cause life-threatening complications. A nurse can maintain physical health by doing even minimal exercises regularly, such as 10-minute jogs, stretching, light lifting of weights. Also, sustaining a well-balanced diet is beneficial to a nurse's physical health. Low blood sugar is actually one of the main sources of fatigue or mental confusion that could cause significant mistakes in the hospital. Essentially, the best way and the most great way to have a mentally stable and healthy nurse is to become a manager. Nurses spend most of their time managing everything around them. Because this is such a huge task, adequate mental health is important in a nurse. Nurses can ensure and support keeping up with their mental health by implementing time management strategies, practicing effective coping mechanisms, and maintaining proper physical health. With the help from these three management strategies, nurses stand an overall greater chance of having an excellent mental health.